on a very tight time schedule, and so while I continue, they may well need to leave. But I think many of you have been here for the whole day, attending a full-day symposium entitled HIV Program Scale-Up and Global Health Systems, sponsored by ICAP and supported by the Rockefeller Foundation. At this symposium, what we have heard is a very rich discussion of the impact of HIV on health systems and the strategies for health systems to serve people with HIV and to serve their broader needs. This, I think, reflects and brings us very much to today's panel and reflections on where we are at this moment in time and where we must go. There clearly, as a number of the panelists said, have been many successes, led by those of you in the audience as well as those of you on the stage. But we cannot afford either the complacency that has set in, that things are working sufficiently, nor can we afford to not attend to the fact that only 42% of people who need treatment are getting it, or that the rates of HIV infection are rising in many subpopulations in our communities and around the world. There are increasing needs for meds while budgets are flatlined. We need creative solutions in systems that work. And I honor the panel for really trying to address the complexity of those needs. The problem is complex. The solutions that work are not simple, although they may sometimes seem clear. As in public health as a whole, public health is about all of our health, but it is all of our health with an eye to ensuring the well-being of the most vulnerable subsets of our society and making sure that they get the equitable prevention and care not only that they deserve, but that signifies our commitment to creating a world of equity that we want to live in. So I think the panel has done a fabulous job today of bringing those issues together. I thank you deeply for the charge you have given us to think about how to move forward with a commitment at many levels. No one solution will be sufficient, but everyone is needed. Access to universal, high-quality care, both domestically and globally, is necessary, absolutely necessary, but will not be sufficient. We need the creation of health systems, as Dr. El-Sadr has said so eloquently, which address multiple human needs in the same person and the family, and understand that one problem, such as HIV, increases risk for other diseases or other outcomes, and that people need to be treated holistically and with their own needs broadly in mind. And we must move to much more sophisticated investment in how we are going to prevent HIV for the future, as well as treat it more effectively. That's going to require all of us working at many levels and together. Thank you all so much for a really momentous afternoon.
Thank you very much. As we leave, I just want to thank all of you for coming, and our former mayor, David Dinkins, thank you. Thank you, Kenneth Cole, for all the great work you do at Amforum. And you should know that one of the participants here, and a great philanthropist and world-class human being here for the Rock and Roll Hall of Fame concert, is the great guitarist of U2, Edge, my great friend. Thank you for coming. Thank you all. Have a great time.